How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melindy, and this is Disruptive Dialogue. Hello, disruptors. Welcome back to Disruptive Dialogue, where we bring you the information that you need to be an informed consumer of U.S. healthcare, as well as providing insights to what is hurting our healthcare system and how we can make it better. This episode's guest is someone who works behind the scenes to help keep our healthcare system working. In today's system, patients, doctors, and insurers often feel at odds because of the high cost of U.S. healthcare, who should be paying those bills, and how the professionals providing healthcare stay in business. One aspect of our system that is unknown to the general public are medical billing experts. I actually used to have my own healthcare business, and a medical billing expert saved me, but I'll save that for a little bit later in the show. But these professionals sit in the middle of our system trying to make an unworkable process a little bit fairer. Their work may not make the headlines, but without it, many physicians' offices would be closing their doors and you would not see them as their patient. Olga Khabinskay is the Director of Operations at WCH Service Bureau. She has had over 23 years in the healthcare revenue cycle management, helping provider organizations reduce denials, strengthen collections, and make smarter network decisions. And while many of you listening are not in healthcare and you may not have understood much of what I just said, hang on, because you do need to know what your doctors, your nurses, and their staffs are having to deal with every single day just to stay in business while also trying to take care of you. And with that, Olga, welcome to the show.
Thank you so much, Chuck. You did a great introduction. We are a big team and a big puzzle between the physician world and healthcare. And hopefully today we get to discuss some interesting topics, how billers are involved in securing the funds and processing daily operations for medical practices.
Well, I'm excited to have you on. And, it's just really funny because, no one knows of all the people behind the scenes that keep our system running. And it is so complicated. And I think we'll get into it. And I think people will appreciate when they go and see their doctor or in their physician practice and the nurse and the staff, what they have to deal with every single day just to stay in business. And what you're going to share is going to shed so much light on that. Mm-hmm. So let's get started with what I consider the hidden side of a doctor's workday. Mm-hmm. Because when most people pictures a doctor's day, they think of a white coat, stethoscopes, needles, and patient care, not hours spent fighting insurance denials or actually chasing unpaid bills. But behind every patient visit lies a financial maze that can make or break their medical practice. So, Olga, help everybody. I'm going to throw you a softball to start off with. Why is it so hard for doctors to get paid?
I think the insurance industry is creating more and more challenges and loopholes to keep the funds and denying the claims. As you said, the beautiful place, right? The medical practice, the setting, the welcoming staff, and everything that takes place. But the world is not so beautiful inside when you look at the back office operations, eligibility processing, getting the benefits verification, trying to identify if my patient is eligible and what's the frequency of services that I can deliver. So there's a lot of things that doctors do behind scenes that's not considered clinical care at all. They're fighting on behalf of their patients to get authorizations. They are proving to an insurance company medical necessities. And this is not something where a physician spending 12 years to get licensed should be doing. And unfortunately, insurance companies are creating these barriers where if you don't make a call, where your notes are not sufficient enough, they will deny care. And that patient will be forced to go to the hospital system, which will create a more expensive bill overall, and forcing the physicians to send the patient out to the emergency room to get care. So it's a very complex world, being a physician and being a participating physician with an insurance company, following these requirements.
Yeah, right along with what you just said, I actually read in the Boston Globe today that Blue Cross Blue Shield in Massachusetts actually is going to use AI to scan all physicians, like 32,000 physicians, and look at high coding or expensive procedures. And
Yes.
using algorithms will basically not deny it, but downcode and pay them less than what the physician billed. And that's without a process. That's without giving them a warning, giving them a heads up. They say, but the physician, they can appeal. But then once again, the administrative burden. So as a physician was quoted, he's like, we're guilty before proven innocent. And this is ridiculous. And what it's going to cause is primary care in particular, to your point, just sending patients to the ER because they're not getting paid enough. And that creates a cost burden on our society.
Absolutely. Blue Cross is not the only one. We've seen tendency with United Healthcare, downcoding, implementing AI, creating more administrative burden for the practice and every, revenue cycle management team that's working with that practice. They're denying claims in seconds, and they're downcoding from a regular office visit to a low-level procedure. And the pattern is pretty vivid. They're actually downcoding also based on the premium of the plan. So every insurance company has a Medicaid, Essential, Medicare plan, and they're basing their downcoding logic on it based on the premium the patients are paying. So it's a significant impact on the industry, and therefore a lot of providers are dropping contracts. They don't want to be networked with insurance companies that are regulating how I will treat my patient. And that's why there is a certain specialties like, for example, interventional radiology, nuclear cardiology. It's hard to schedule appointments with them. There's a waiting line, 6 to 8 months for a patient who really needs it tomorrow.
How much time do you think that doctors actually spend each week dealing with billing or insurance issues?
Well, it depends if the doctor is directly involved. So this could be a small primary care practice, could be a specialist that is operating on their own and they have their own internal billing department. The employer will spend about 5 hours a week. And that's considering looking through denials of actual statements that they get from insurance companies, speaking to their peer-to-peer, figuring out if they're getting similar rates, right? Referring back to the practice management program, right? Where is the aging report? When is the last time we got paid? Are we collecting co-pay? So physicians that are running their practice internally within the billing department, they're spending more time. Physicians that are outsourcing billing to professional billing companies that are doing the oversight for them, they're spending about an hour a week on communication and restructuring eligibility, improving on certain processes the billing company tells them. So it varies on the size of the practice and dedication the doctors have. They're super busy. Finding those 5 hours a week for a privately owned clinic, it's hard. That means they're taking that time away from patient care or from their personal time. So it's important to kind of look where the struggles are. Do I need to think about giving up my billing to a company that knows how to do it better? So there are many questions that come up when the doctor is evaluating, but physicians should not be spending time looking through denials, right? They should be looking at their bank and checking deposits if they need to. But the reality, unfortunately, today is that we get higher percentage denials than ever before with AI, forcing us to review denials carefully because we have to plan appealing them, reconsideration cases. So it's a bunch of issues that physicians are forced to do now and paying more time to the employees to handle these processes.
Yeah, there was a large study, I want to say by KFF, Kaiser Family Foundation, that basically said physicians spend about $26 billion with a B dollars a year in administrative costs through prior authorization, utilization management, billing, insurance, etc. People talk about, drug prices are so much more expensive here than Europe, etc. Look, first off, all the studies show that everything in the U.S. from a healthcare standpoint, hospitals, physicians, medical services is more expensive in Europe. But the one thing that showed that we were drastically more costly than Europe and other developed countries was the administrative expense, which is what we're talking about here.
Yep.
So, people go, well, we don't want a one-payer system and all this. I mean, I'm not promoting a one-payer system, but you are in the business not only of helping with billing and billing issues, but also getting reimbursement. And I'm sure Medicare doesn't always pay as much or as quickly as they should. But if you had to compare billing issues between private insurance companies and government programs such as Medicare, Is one better than the other? Is one less burdensome? What would you share there?
I think Medicare, considering it's a federal system, it outlays the max for each state and the rules are generally the same. I think this system has more transparency. I feel that as a provider or a biller of a provider, I can find out answers pretty quickly. I know where I can report problems if I have them. If there is an overpayment, an audit, an issue that I have a place to go to. When it comes to private insurance companies, right? I feel that I'm in the wrong game. This is where the authority of the executives who are not MDs are making decisions on benefits, reimbursements, trainings, participation status. Like there are a bunch of closed panels right now to get in. Radiologists cannot get into United Healthcare for years, right? They feel there's no need for them, but there is a need. So it's very hard to work with commercial payers because it's hard to speak against their policies and to have a voice in the network. If you speak up, you get turned down. So, and we started seeing this on TikTok and Instagram. Doctors are voicing their opinion about lack of authorization services policies, and they are getting rid of them through dropping their out of network. So it's becoming an issue. So what doctors are typically doing is they choose to accept Medicare, they credential with Medicare, they credential with Medicare Advantage plans, and they feel that Medicare time schedule is quicker, right? You get a payment in 14 business days, 14, 16 days. It works like a clock. With other insurance companies, you might get a denial in 3 days, but a payment in 4 weeks. So it's an issue where you have to chase the cat and tail game. You have to constantly be involved in a cycle of claim processing to make sure that you can pay your bills and that your claims are being processed properly. So it's always the investigation mind where you have to keep track of everything. So I think, from my opinion of 23 years speaking to doctors, when there is transparency, rules, and policies, that's a good insurance company. They're for the providers and for the patients. For other commercial payers, it's hard to say the same.
Yeah. And it's sad because, it was initially, as you well know, it was built to make sure that appropriate practices and medical decisions were being made and they weren't getting overpaid. It has become now a way to delay and deny payment. So let's transition a little bit. So, I've called on doctors for almost 40 years and, they always say, I got into medicine to take care of patients.
Right.
But staying in business has become a full-time job for them. Like I said, many of them, and now they're starting to add business classes to medical school. Yep. But every time a doc submits a claim to an insurance company, I know that there's a chance that it'll be denied. Sometimes it could be just because of a tiny typo or a missing, like you say, a modifier or some obscure rule that no one warned them about that actually could be a new rule. So this whole denial game and insurance companies saying no, give everyone a feel for if they go and see a doctor, nothing special. I go and see a doctor, go get my physical, whatever. How long does it usually take for a physician to get paid for a typical office visit?
Okay, so if everything works as a clock, so the front desk logging in the patient information, everything is prepared, the patient gets treated, the doctor completes and signs the note to make it an official, that turns into a claim. If the billing is done within the office, you're talking about 24, 48 hours probably turnaround time. If the billing is done with the billing company, up to 72 hours, depending on the frequency they have. And then you're adding few weeks for payment. So in about 4 week cycle, the doctor typically gets paid. And if they're billing weekly, they start getting weekly checks, right? But again, the word payment is very difficult to use because we are facing denials more than payments. So 30% of the claims, 27 to 30, get denied immediately by some of the specific big payers, right? Based on the algorithm of AI or internal policy requirements that they've placed. And that becomes, a management issue, right? The physicians are not getting paid, and it creates week to week growing problem for each insurance company. So without a team handling it, it becomes an issue that escalates, that turns from 100 claims to 1,000 claims. And somebody needs to work at that and continually monitoring that. So it's an interesting dynamic that Medicare, for example, pays the claims within 16 business days. The actual check drops on doctor's account within 16 days. And they love it because that's the only system that works like a clock. Everyone else, you're looking at about 3 or 4 weeks after they receive the claim. So that would be the general expectations kind of.
So Medicare, just over 2 weeks.
Yep.
Everyone else, about a month. And that's if everything goes smooth, everything is done right, and there's no appeals, which we know from what you just said, 27 to 30% of the time, it's going to get appealed. What's one of the most frustrating or absurd reasons that you have heard for a denial?
Oh, the reasons are all there are fun reasons. I think we had the cases where the patient was declared dead, and the patient was not dead. The patient was actively in the practice, but something happened with the coordination of benefits on that file, intentionally or not. But we saw a pattern of the same denial code several times from the same insurance company. So I feel it was the matter if the practice will catch it, they will try to hopefully appeal it. If not, well, the insurance company won. They did not pay that claim. So coordination of benefits, it's a big issue. If the patient, if the members are switching plans, get married, never update their policy, we see that a lot being an issue. Another one would be where denials are happening because of the algorithms of AI, like they are denying nuclear cardiology all across the board, the specific code. They don't feel it's medically necessary, and they're denying it.
I love having you on it because you are talking the blocking and tackling of what's happening every single day. And one thing I really wanted to ask you was, we hear about this physician shortage and physician burnout. Do you believe or have you seen good docs folding up practice because of billing and collections, primarily being the reason? I mean, do you see that very often? Do you see docs getting bought by hospitals or private equity because they just can't handle this anymore? Do you see that?
Yes, we see that. We see that quite a lot, depending on the area, depending on the specialty. But the biggest problem is that they cannot sustain financially to operate with all the pitfalls and challenges that insurance companies are placing. I see a lot of mergers or acquisitions of the hospital acquiring physician practice because the physician is burned out. They want to be with their families. They want to come to work, treat patients, and not deal with administrative peer-to-peer review process, they call this, when I have to fight on behalf of my patient, my desire and plan to treat a patient based on how I believe is the right thing to do. And yet insurance companies denies the care and denies the authorization because they feel it's unnecessary treatment, right? So physicians are burned out. I don't see that so much in the youngsters, the people who are just, excited and motivated. They come out of residency and they take out a loan. They open up a shop, I call it, right? But,
Nice.
right. And they start seeing patients. They're strong and motivated. And in 5 years, they hate it. They turn to concierge service because they don't want to deal with insurance companies, right?
Yeah.
Or they start doing aesthetics, right? Let's get out of insurance. Let's go into private pay. Let's add something else. So they're trying to be creative to flow, to be financially secured. But yes, we have seen physicians in early 40s till 70s, in the late 70s that are, I don't want to do this anymore. I want to be a medical director. I don't want to be a billing manager. And they are signing up for 5-year contract and stepping under the umbrella of a hospital or a larger healthcare network.
And what's crazy is the physician, independent physician, private practice physician, because of insurance administrative burdens and the lack of pay, they are moving to the hospital systems where they are now more expensive for patients, for insurance companies, and for our system. I mean, it is absolutely insanity. So something that we are seeing more and more of, and actually this is the kind of plan I have, are high deductible health plans. Many Americans are going to these because we're here, you know what? I'll pay a higher deductible if I can have a lower premium because I'm pretty healthy. But what we're seeing is that it's resulting in doctors increasingly have to collect money from patients directly versus through the insurer. And that's often when the patient assumes that the service they're getting is covered by the insurance company. So Can you expand on why you believe there's been a big move towards high deductible health plans or HDHPs and how they've shifted that financial burden from insurers to patients and also straining that patient-doctor relationship?
Well, they've created this enormous amount of different packages that if you want to be with United Healthcare, Cigna, with Aetna, let's look at your premium options, right? And for some reason, people are running into the lower premium models, disregarding the fact of how much the deductible is. Sometimes it's 5,000.
Oh, yeah.
Right. And it's lack of education on the insurance side too. They're marketing the lower amount of premium, but they're hiding in small letters the actual deductible and the cost out of pocket expense for that patient. And they've completely shifted the responsibility to the doctor to deal with the patient. So now the front desk is the boxer, right? So you walk into the practice, I am sick, or I'm looking for your help. And then the first thing they tell me, I have a $2,500 deductible before they can see me. So of course I'm going to turn around and leave. I will be disappointment in the doctor, not in my policy. Right? So they're breaking the relationships, right? They are forcing the patients to hate the providers. It seems like it's their contract with the insurance company. No, it's the premium you've chosen. So I've learned that those that have implemented, a direct communication with patients before the visit, they are saving their reputation as a clinic. And they are informing and educating that member what they need to do and what they need to understand about their policy. Because they're going to get a bill, they need to be informed about it. And there's not a lot of options for that patient because he's in network. That's the benefits they're going to get. So he's going to go to an urgent care, pay a $210 copay because those are also pretty high. And will they get the services they need? I have no idea. But the system is broken. They're not educating members. They're trying to sign them up through incentives with a low premium, and it's creating a big issue. And right now, if you look in the market, the companies that do patient collection are rising. And they're automating through text message, through emails. Too many options. But in reality, we need a platform that allows us as members of an insurance company to log in and to see what will actually be the financial outcome, my responsibility if I'm going to go to this doctor, right? To make it more transparent for everybody. But hopefully the government has noticed this. The CMS has noticed that there's lack of transparency. So I'm hoping there will be a shift with the new administration, with Dr. Oz especially pushing transparency and fee schedules to be available publicly. So that's as much as I can say on this topic.
When you think because you're paying lower premiums that you have a high deductible, that when you go in there, guess what? You're paying out of pocket until you hit the deductible. And most people like myself, you're not hitting that deductible within the year. So basically you pay your premium in case you have a catastrophe, but everything is paid out of pocket.
But the process has to change. If this is the way the premiums are going to be so low and the benefits are going to be, at limited stage because of the deductible, it becomes an issue with patient care. Do I really need this insurance? Should I be going out and getting, another coverage or something, or getting Magna or Cobra if I'm laid off from my work? So I don't know. There's so many options that patients have to now look into.
Yeah, and I think that's another thing that's an issue. I mean, here we talked about, Medicare, traditional Medicare, not Medicare Advantage, traditional, true Medicare, that it's probably the most effective and not only cost effective, but from a operational standpoint, the most effective and easiest to use. Mm-hmm. And it's run by the federal government. And the insurance companies are the ones that are making this whole system so complicated that nobody understands it. To your point, with Medicare, you go to the CMS site, you know where to go. You can call someone. I've talked to them before for my mom. It is so simple. Good luck. You're probably going to go to the Philippines and hear a call center if it's for an insurance company. It's crazy.
It is.
So you mentioned earlier, AI, and we hear in the news a lot about the denials with AI and the algorithms and the payers are using it. However, there is AI on the flip side. I've heard of some different things like AI or predictive analytics that will help physician practices identify patients who might need payment plans or financial counseling before they get a big bill. Another tool I heard was predictive analytics to help docs forecast their cash flow. Because as you've already pointed out, all the challenges with revenue cycle management. And then lastly, using some AI-assisted tools that can scan claims before they submit them for missing data and fix errors before they're sent for payment and get denied. Have you heard of any of these or other pieces of technology that you think might be able to help us?
Right. But I think what every doctor is trying to do is to minimize administrative time. So they want to give time back to the practice. Instead of having a call for 45 minutes for authorization, I want an AI to take authorization. I want AI to do my notes. I know it's a crazy dream, but every single doctor needs a scriber, not in a physical human form, but an AI form. And I've seen technologists like Suno in the clinical EMR. They have adopted a tool, and it literally takes 15 to 17 minutes, gives time back to the doctor. And it's documenting everything. It's also comparing past visits. So technology is supposed to give us time back so we can concentrate on something else that I can do. Maybe, do a conference. Go out, do a webinar, right? Teach, right? Every single doctor wants to teach. They want to grow professionally. They don't have time to take CMEs. They take CMEs when they go on vacation with kids online. I've seen this. So I think AI, if anything, if it's doing anything good for the doctor's life, it should be giving them time back, right? So definitely doctors who are looking to implement something, they need to look at their pain points. Where I'm spending more time. What can I replace? Don't replace front desk. We need to communicate with people who may answer, please.
Don't replace the people. Just replace your scribe.
Yes.
And make it better. So, Olga, you probably better than almost anyone else knows the reimbursement system in the U.S. If there's just one thing that you could change in about the reimbursement system that you think would make it better, what would that be?
I would like to have fair reimbursement process for physicians of the same specialty in different regions. So the metrics is wrong. If I'm a radiologist in New York and I'm doing the same service, there's no reason for somebody else in Florida to get paid less for the same specialty, for the same service. So it's again transparency. I'm calling for transparency. But it's the pain point when we're negotiating contracts for our doctors because they heard their best friend in Texas is making more money and they're also primary care. With Aetna, he's rushing in to complain, but he has to do it properly. He can't release the NPI of the doctor, right? So we need transparency. There has to be rules that are set up for identifying payment methodology, which CMS did pretty well. It's out there, use it, but insurance companies are abusing it. They're not using it properly. So that would be it. And probably a little bit boost in fee schedule for some of the nurse practitioners who are doing such a hard job working on behalf of providers many times, and they get paid 85% off the physician fee schedule. So they're drastically cut, but their bills, liability insurance, malpractice is still the same. So we need to look at, at all aspects of medicine and look at the cost of being in medicine, in the business of medicine too.
A physician one county away or in the same zip code could provide the same service for the same diagnosis for the same insurance company, and the reimbursement is different.
Yeah.
And that so some type of standardization is what I hear you saying would be helpful. If I gave you a magic wand and said, okay, you only get to do one thing, not just for billing and physician reimbursement, one thing that you think would have a huge positive impact on the U.S. healthcare system, what is one thing you'd like to see?
Well, because I'm in the industry of billing, I am going to wave my magic wand to say that I wish there was some kind of trusted biller program where, like Yelp, right? How can I rate my biller? How can I know without working with you that you are a good partner for me? And there's no place like that. So I wish that maybe insurance company would allow billers to have the voice and allow a platform where doctors can interview and choose a billing team they need based on reviews, right? Like dating apps, right? Let's match.
I love that.
So that would be my wish for this year and upcoming year as well.
Now, my wish, and people have heard it, is that I don't think that these large insurance companies and their affiliates should be able to be publicly traded. Because at the end of the day, their fiduciary duty is to their shareholder. And if you look at some of the financial results that just came out, I think Universal Plan, United, one of the Blues, they all came out. HCA just came out. They're all showing like in the 20 to 30% increase in revenues, 20 to 30% increase in profits just for the past quarter. And they're crying that they're not getting paid enough, and they're charging more to patients and giving less to providers, yet they're making double-digit 20, 30% revenue and profit increase, and it's disgusting. So that's not a high note, but I do have one thing I wanted to ask you about. So I went onto your website. I checked out all your stuff. By the way, I told everybody earlier, when I was in the early 90s, I started my own medical equipment supply business. I bought my partner out. He had a biller. I didn't realize how important the biller was. I was the sales guy. And so my mom and dad helped me out. I'm probably 30 years old. We're billing for durable medical equipment. I didn't have a biller. And this went on for like 3 months, where I had tens of thousands of dollars backing up because I had no idea. I did not know the system, how to do it, the software. I had $1,500 in my business checking account. And the lady that I got to help me with my billing called and says, your first Medicare check is coming in, and it saved my business. So when you and I connected, I'm like, I love billers. They really do save you. So yeah, and that was a little small business back then. So, but I read your mission, and I want to say your mission. And then I'd love for you to tell us where this comes from, because it's great. So your mission statement says, it is your mission to assist our employees, customers, and the communities we serve in achieving their dreams and goals in life and in business. Confucius put it best: if you want to succeed, help others attain success. If you want to reach your goal, help others reach theirs. Where'd that come from?
Well, because everybody who we talk to tells us, well, thank you for making this happen, right? So they have a dream. Maybe they want to have a fancy car or live in a nice house, or they want to donate to charity. Our goal is to make sure they get paid on time, and that the rules the insurance company is utilizing are properly addressed to their practice. So we try to bring, real good news to doctors. Same thing for our employees, right? If we can make something happen that will benefit you personally, professionally, this is our company. You succeed, we succeed. So you can look at it in different ways, but it's all about looking at what we can achieve for our clients to make them successful in their dreams. So it's just a more passionate way to look at life.
I love it. I didn't know I was dealing with a Zen master today, but that is fantastic. Olga, before we wrap up, anything else you'd like to share with the audience?
No, I think you covered everything. If anybody's looking for a second opinion, or just to talk about, pain points within insurance companies, or just want to analyze, if I'm doing everything okay in my practice, reach out. We're here to help. Just the way we're speaking now, we'll have a nice conversation together as well.
That is awesome. And so, Olga, thank you so much for sharing all your insights today. I think everyone is starting to realize how dysfunctional our U.S. healthcare system is, and that it's no longer just about a doctor or a nurse taking care of us.
Yeah.
And for everyone listening, if you would like to contact Olga and her team, go to www.wchsb.com. There you can find out everything that they do. You can also go to my website, disruptivedialogue.org. We'll have all of Olga and her team's information in our show notes. Lastly, thank you for joining us on Disruptive Dialogue. If you enjoyed this episode, please subscribe, share it with a friend, and leave us a review. And until next time, stay informed and take charge of your health. Thank you so much.